Now, on Tuesday, we did a programme at Clarence House, guest edited by the Duchess of Cornwall. I hope many of you were able to join us for that. It was certainly a very, very unique lens on the world through the issues and charities close to her heart. If you want to hear my conversation with the Duchess again, you can catch up on that on BBC Sounds. One of the charities that she was keen to highlight was Roald Dahl's marvellous children's charity. They provide specialist nurses for children with rare conditions that perhaps don't get the attention that they deserve. There are 78 Roald Dahl nurses across the UK who help 21,000 children. But the charity says 100,000 children with rare conditions need support right across the UK, and that means almost 80,000 children are missing out. Louise Grew is the chief executive of the charity. Louise, a warm welcome to the programme.
Hi, nice to have you.
Thank you very much for joining us. Just to start with, when we say rare conditions, what are we talking about?
We're talking about sort of underfunded, under-recognised conditions such as sickle cell disease, epilepsy, rare diseases where there's hardly any children in the UK that have them, or undiagnosed as well in some cases.
And in terms of Roald Dahl nurses, which is not a phrase that, everybody will be familiar with, perhaps they're more familiar with Macmillan nurses for cancer sufferers. What are Roald Dahl nurses?
Roald Dahl nurses are specialists in their field, so they're experts in particular disease areas, and they're dedicated to a group of individual patients, and they work specifically in these underfunded, under-recognised conditions. And the conditions are lifelong, they're complex, and often the children are under multiple consultants. So they look after both the patients and their family, and they're there sort of almost 24/7, being there at the end of a line or in person to really support the family and navigate the complex health sector.
How does Roald Dahl come into this?
So there was so much more to Roald Dahl than his amazing stories that everybody knows and loves. His incredible life was affected by serious illness and tragedy and loss himself. And it was his personal experience of that illness and tragedy, and those of his family too, which really spurred him when he was alive to help seriously ill children and their families. And he really believed in taking practical steps to improve those lives.
Well, for people who don't know, when you're talking about the difficulties Roald Dahl faced, can you tell us more?
So he had a child who had a serious illness, and he had a child who unfortunately passed away. And he also had members of his wider family who were very seriously ill as well. And so he used his sort of creativity and determination to really help pioneer new medical treatments, such as the Wade Dahl Till valve, which was a device used to help thousands of children with hydrocephalus. But he also gave, his time really generously and money to help those families, including many that he hadn't even met.
Thank you for that. Let's bring in Laura Longhurst at this point, because Laura's son Carter is helped by Roald Dahl specialist nurses, and we'll also be hearing a bit more about what that role is like from Tina as well in just a moment. But Laura, good morning.
Good morning, Emma. Thank you for having me.
Lovely to have you on the programme. Thank you for making the time to talk to us. Tell us about Carter and what medical challenges he faces, and how, if you like, he's been affected by all of this.
So Carter is 10 years old. He is the middle child of 3 children. We had an incredibly difficult pregnancy with Carter, and as a young baby, Carter just didn't meet his milestones as would be expected, and as parents we knew that something was wrong with our little boy. That's when we fell under Birmingham Children's Hospital, and the amazing medical staff there put us in touch with the rare disease team and the Roald Dahl specialist nurses. Until Tina, our nurse, walked into our lives, as a parent, I felt like we'd hit an absolute block. I felt incredibly isolated as a mum. Managing multiple appointments was becoming difficult, as both my partner and I, we both work full-time. We're railway workers, so we work shifts. there were times when Carter would become incredibly upset and anxious, and I was really struggling to deal with some of the issues and the appointments and the medical jargon as well. So we were introduced to Tina. Tina, for me, is our superhero. Carter is incredibly attached to Tina. Tina takes the pressure off us as a family. As Louise just said, Tina is there 24/7 for us. She's a phone call and a text away. Carter had a routine appointment on Tuesday at the hospital. He needed to have bloods taken, and as a family we've been shielding with Carter due to his condition. And Tina was there. Just being there in that room, Carter feels much braver. So Carter's condition, Carter was diagnosed with a collagen connective tissue disorder known as Ehlers-Danlos syndrome several years ago. Carter dislocates his joints on a daily basis. He also has problems with his gastric system and his bowel. He does use a wheelchair at times. He becomes incredibly tired. He struggles with pacing needs. Carter's also recently been diagnosed with Asperger's syndrome. So Carter does struggle with social interaction and relationships. Carter also has several other issues whereby his left side has now stopped growing in comparison to his right side. We have 10 different consultants that look after us. We have lots of hospital appointments. But Tina puts Carter at ease.
So important to have that for you. I can hear how important it is on every level, not just for Carter, as you say, for you and your whole family to have that break. Let me bring in Tina. Good morning.
Good morning.
Thank you so much for taking the time out to talk to us.
Thank you for having me. Thank you.
You know, I can hear it in what Laura's saying, but you do an amazing job.
Oh, thank you. Thank you. It's an absolute privilege and an honour to, be a Roald Dahl rare disease nurse. It really is, in my opinion, the best job in the world.
Laura, is there anything you want to say to Tina?
We tell Tina often how special she is to us. Carter even entered into negotiation with his main consultant last week via a telephone appointment to say that he would only be willing to have an MRI scan if Tina would be in the room with him. That's how important she is to us and Carter. Carter's sat next to me at the minute because he doesn't want to miss an opportunity whenever Tina is around. There's the Roald Dahl specialist nurses care for, as you said, 21,000 seriously ill children, and there are over 100,000 children like Carter in the UK, and they all deserve a Tina in their lives. Because it makes a huge difference. And I don't think a thank you will ever be enough from us as parents. And I honestly believe that the impact that Tina and the other Roald Dahl nurses have on Carter and children like Carter will live with them for a lifetime.
Oh, I mean, I'm nearly in bits, Tina. Are you okay?
Yeah. Yeah. I mean, what can you say?
Let's get Tina. I mean, how are you doing? I can actually see where you're on the phone to us. You're in your uniform. You're in a lovely looking room there with some decorations on the wall. Is that the Little Mermaid behind you?
It is. It's Ariel, yeah.
And I mean, the impact that you have in your job is just enormous, isn't it?
It really is, and we see that when we start with families, we're often starting with the families at their lowest time, their most desperate time. They've received a diagnosis, or we're in the process of trying to discover a diagnosis. And like Laura said, they're under numerous consultants. There's all that medical jargon. and are expected to deal with this on their own. So when we come in, we just hold their hand and we're there.
Oh, the line is a little bit against us, and as anyone will know in medical facilities, the signal can be a little bit difficult. We'll see if we can get you back, Tina, because obviously we want to have your voice in this as much as possible. Let me go back to Louise, who's the chief executive of the charity. Louise, we've got a window there into a very strong relationship that develops.
Absolutely. And to be honest, this is across the board. I mean, I'm humbled every time I meet one of our Roald Dahl nurses. They go so over and above everything you can imagine. And, when I speak to the families, as Laura said earlier, it's just a lifeline for them. And sometimes it is the only person that the child, but also the family trust, because they really understand their conditions, and they're really, working with all the different consultants. They're trying to reduce the hospital visits. They're trying to be there at the emergency times, and really, really be the go-between between the family and all the healthcare professionals that they have to see. So it's an incredible position, an incredible role, but also incredible relationships that build up.
Let me come back to you, Laura, if I may, just to bring another point to this, because when we had the Duchess of Cornwall editing the programme and we were looking how lockdown has been, this is the lens through which we're all living lives right now. How has it been for you and Carter and your family?
It's been really tough. Obviously, my husband and I, due to Carter's condition and the fact that COVID could make Carter so poorly, he could risk his life if he were to contract the infection.
Yes.
Tina has every week called me, video called us, text, just to check that we're okay. We've had to heavily rely on friends and family to make sure that we're okay. My husband and I both work for the same railway company. They've been fantastically supportive, as have all our colleagues. Carter's been so concerned, though, about Tina, and knowing that she works in the hospital, possibly coming into contact with COVID patients. And just once a week, Carter just likes to check in and check that she's okay and that she's looking after herself. And that's something that Carter's completely chosen to do off his own back. And I'm so proud of him for that. And he recognises that Tina has a massive role to play in our family. And it's the little things that the Roald Dahl specialist nurses do. At Birmingham Children's Hospital, the nurses arrange parties and get-togethers. Obviously, currently during the pandemic, that can't happen, but it enables the children and their families to get together with others that are like them, so that they realise that they're not alone in this world and in this fight. But during the pandemic, Tina, she's gone above and beyond. She's ensured that Carter's medications are prescribed on time and that they are delivered to us when we need them. She's arranged for Carter's appointments to take place over telephone or via video call. She's given us so much reassurance, of when it's safe.
Which is so important. I mean, it's so important, and I'm so happy that we could bring you all together and shine a light on this service that has been able to carry on in a variety of ways during this very difficult time. Laura, please send our best to Carter and to all of your family. Thank you for coming.
I will. Thank you so much, Emma.
And Tina, a huge thanks to you for all that you do, and it's so wonderful. I hope you feel the same, to be able to recognise how brilliant you are this morning.
Absolutely, yeah, and I'm sure Louise has mentioned the Roald Dahl's Marvellous Children's Charity is launching a nurses' appeal, to ensure more funds are available to employ more Roald Dahl nurses, which is just such an important role for children who are facing these health conditions.
Indeed. Well, she actually hadn't, so well done there. You got it in, and it's very important to do so. Thank you very much for talking to us, all of you. We know how busy you are, and you're doing incredibly important work. Louise Grew there, Chief Executive of the charity, Laura Longhurst, whose son Carter relies incredible amounts on Tina Boswell, who is a Roald Dahl specialist nurse in Birmingham. To you all, we say a huge thank you.